First of all, I would like to thank Professor Carraro for the invitation, for the opportunity to share the experience we are making at the University of Padua on the optimizing of the home-based full-body in-bed gym. That is an original exercise protocol developed by an idea of Professor Carraro. So, as we have already said during the morning, we know that while aging, there are a lot of changes in the elderly. And one of the main changes occurring while aging is the little time that elderly subjects spend in daily physical activity due to the advanced age and to the possible comorbidities. So this inactivity is like a river that slowly flows and slowly changes the surrounding landscape. And so consequences of inactivity can be the loss of muscle, so as we have already seen in the so-called muscle atrophy, and the further limitation of activity that can force elderly subjects to prolonged time in bed and maybe also to hospitalization. So, as we have also seen, and as the previous speaker has presented in an excellent way, there are some strategies to revert or even prevent the loss of muscle and the changes occurring during inactivity and during aging. One of the main strategies is exercise that can act on the overall body and in a lot of systems, for example, changing metabolisms and reducing inflammation, but also can act on the cellular system, acting on the mitochondrial, as we have seen, for example, on the volume of mitochondrial and on the production of transcription factors, of mitochondrial transcription factors, but also modifying the capacity of mitochondria to produce antioxidant enzymes and preventing the expression of proteolytic pathways. So in a recent publication, we have summarized the possibility strategies to prevent and to reverse the consequences of inactivity in the elderly. We have divided the patients group in two different groups. On the one hand, the pre-frailty patients, these subjects that are still healthy but are at risk of developing frailty. And on the other hand, the frailty group. And for both this group, we have found that different kind of exercise interventions are suggested to be effective, such as exercise for joint mobility and strengthening the muscle, but also aerobic training, balance training, fall preventions, and even nutritional supplementation. This kind of exercise can be performed in different settings. On the one hand, we have found that the inward settings is effective for patients to perform exercise, given the fact that in these settings we can perform tailored rehabilitative exercises, but also we can provide patients with comprehensive evaluations. On the other hand, also the home-based settings has demonstrated to be effective for different kind of patients. For example, in patients with musculoskeletal rehabilitative needs, such as patients with hip fracture outcomes, the home-based settings are demonstrated to have no differences in the outcomes when compared to the in-hospital settings. But also for patients with neurological needs, the home-based intervention has demonstrated to have similar outcomes to the in-hospital settings. And furthermore, in the home-based setting, we have also the possibility to offer to our patients a greater family support. So our proposal is to transform the bed from a place to rest to a place to train, so to a private gym. And so we propose the so-called home-based full body in bed gym. So maybe you have already know something about the home-based full body in bed gym, but what I want to explain now are the few basic principles that are at the basis of the full body in bed gym. The full body in bed gym is developed from well-established protocols used for patients with outcomes after surgical interventions, such as patients with cardiovascular respiratory surgical outcomes. And these protocols integrate resistance exercises, aerobic training, and maximally voluntary contractions that can be performed even in the acute phase after the intervention. So, in the after the surgery. So, in the first days when patients are forced to stay in bed. And from this protocol, we keep this idea, and we wanted to expand even to subjects that are not in an acute phase of disease, but to subjects that only want to prevent some consequences. And so we developed this program that is a very short program, a very feasible program that lasts from 10 to 30 minutes and can be applied from every subject in their home. So this is the journey that Professor Ugo Carraro has performed from the firstly idea of the full body in bed gym. In 2013, he started to exercise, primarily focusing on body weight exercise. Then over the years, he applied this exercise in bed, and he continued to perform the exercise even during hospitalizations. And then from 2019, he started to publish the results, the primary results of these protocols applications. So firstly on himself and then to greater population. How? Because during the pandemic, many patients and many subjects were forced to stay at home, and they are experiencing several consequences, not only for the enforcement to stay in bed, but also for several symptoms that can occur even after the resolution of the acute COVID-19 infection, so the so-called long COVID syndrome. So we performed this protocol both for patients in lockdown, but also for patients experiencing long COVID syndrome. And so we expanded the populations that perform the full body in bed gym. So now I reported what is now the protocol we are suggesting to our subjects. So 10 simple exercise as reported in the table, exercise for the upper part of the body, for the lower part of the body, for the abdominal, the trunk muscle, and also for the pelvis. And so as you can see, ankle flexor extension, exercise for the arms, for the limbs, for the abdominal, and for the cervical spine muscles. And these exercises are performed every day, are only 10 exercises that can be repeated starting from 5 repetitions and then gradually increasing this number up to 30 repetitions. In patients with a denervated muscle, we also suggest to combine the protocol also with the use of functional electrical stimulation. So to the applications of electrical stimulus, electrical currents to specific muscle groups that can help to have a synergetic effects with also the exercise protocol effects. Okay, so I reported here a short video explaining the exercise that can be performed at home. As you can see, simple exercise for the lower limbs, for the upper limbs, so flex and extensions. And so also some exercise for the pelvis. And this video is a video that also we suggest to our patients and to our subjects to see at their home in order to have an indication of how the exercise can be performed. You know, exercise in bed, at the edge of the bed, and also passing from the sitting position to the upright position. Okay, so we arrive to the experience we are making now at the University of Padua. We are collecting data from subjects, elderly subjects that have decided to perform this protocol at their home. And we have now included 22 subjects, 22 elderly subjects, and they are performing this 10 exercise protocol, the home-based full in-bed gym protocol, at their home 3 times per week. Initially, we have required to this subject to perform this exercise for 2 months. And we have provided the subjects with the previous video I've shown you and some documents to support the exercise performance. What we are evaluating, we have started by evaluating quality and quantity of exercises, calling patients for weekly phone calls. And then we have also measured some outcomes before and after the 2 months of protocols. In particular, we have measured pain perception, quality of life, and the risk to develop sarcopenia during this period. Also, we have requested our patients to evaluate the protocols we have provided them, so requiring to express their satisfaction regarding the program. And finally, we have evaluated the adherence to the treatment even after the 2 months of protocol. So we call again patients 6 months after the end of the protocol and asking them if they were still training with the full body in-bed gym protocol. So here are the first results of this study. So here you can see the results regarding the pain and the risk to develop sarcopenia. One of the things that I would that you notice is that when referring to the age of our patients, we included subjects with a mean age of 72 years old, but also we have a subject that was 85 years old. So we have the possibility to apply an exercise protocol that is feasible also for patients with a very advanced age. And these are the subjects that are greatly inactive. So in most of cases. So this is a protocol that can be applied really at every age. And also the BMI is interesting since the body mass index we collected also included some patients with obesity and, also in sarcopenia, the importance of obesity that can have a synergistic effects in the so-called sarcopenic obesity. So these are 2 points that I want you to notice since it's really, really important. And regarding the results, we have a small group of patients, only just a few more than 20 patients, but regarding pain, we obtained some interesting results with a reduction in only 2 months of protocol of the pain perceived. And also we collected a little trend to reduction of the sarcopenia risk, even if it wasn't not so significant. At 6 months, what we detected was that patients were highly willing to continue to perform the protocol. So 9 subjects referred to continue to perform the protocol in the same way, so 3 times per week. And 3 subjects referred to have reduced the protocol to twice a week. So a total of 12 patients continued to perform the protocol even when the physician control was lacking. No, the imaging is not correct. I don't know why, but this is another study we have recently published about the quality of life, and also regarding quality of life. it is interesting to notice how the mental component of quality of life in these patients was increased after the performing the protocol, since we know that exercise act also in mental concerns and in psychological concerns. And this is particularly true also in the elderly age. So we obtained an increase, an amelioration of the mental component of the physical or the quality of life. So this is interesting, since it seems that this kind of simple protocol can also act on the psychological well-being. And we do not detect any adverse effects. And when patients were asked to evaluate the treatment, they reported a great level of satisfaction. So it is a treatment that is highly appreciated by patients. So to conclude, just a few results regarding pressure. Also regarding pressure, these results are evaluated on a single subject, that is Professor Ugo Carraro. We collected daily pressure from in 1 month, and what we collected has been that the diastolic pressure in particular seemed to be reduced after the performance of the protocol for 1 month. So this is interesting, since also not only effects on the perception of pain, the perception of quality of life, but also some objective results we have started to collect. So to conclude, we know that during the advanced age, some changes are occurring, but we have different ways to contrast the inactivity of the elderly. And one of these method can be the application of simple protocol that can be performed at home or even in bed. So the home-based in-bed gym seems to be a way to contrast inactivity during advanced age. And so we are trying now to expand the field of research applying this protocol. So collecting blood sample or also pulse oximetry, so to detect the saturation of the oxygen saturation of blood. And finally, also combining the protocols even with some nutritional support and nutritional changes in our subjects. So that's all. Thank you for your attention, and thank you for all the components of my research group and of the research group of Professor Carraro.